Okay, so while I wait for my presentation to be loaded, I will just want to thank the co-chairs for the introduction. Thank you, Dr. Victor, for your talk, which brings me to my talk. My name is Rirhandzu Ndzhukule. I am an investigator at Cape Town, South Africa, at the Desmond Tutu Health Foundation. And as you can see, that's a picture of our beautiful site in there. I'll be talking mainly about the innovations regarding the diagnostic when it comes to the STIs, in keeping with our theme for the workshop, which is building a brighter future and staying ahead of the evolving landscape. So I will just outline of my talk. So I'll firstly talk about the screening. Also, my height is making sure that I can speak. Okay. Yes, thank you. Oh, much better, thank you. So I'll talk about STI symptom screening and basically what this means if you're a young person or any other person going into a health facility. And I'll also talk about a few diagnostic tests that we use. And I'll talk about the work that we're doing at site, including the GIF device, but more about the GIF device later. And also touch on the vaginal microbiome work that we're doing at the site. So if you go to a healthcare worker and you have an STI, mainly it's going to be, you will have to, if you're complaining of symptoms, you have to self-report on the symptoms, or the health provider herself or himself can ask questions regarding the STI symptoms. So that's health provider-initiated STI symptoms screening. The provider-initiated STI symptom screening has the advantage of it may increase treatment of symptomatic cases because some patients might not be aware of their symptoms. And we've heard a lot about stigma during this course, but there is also stigma regarding the symptoms, the STI symptoms that people can have, and that might hinder the self-reporting. So people might not be forthcoming with their STI symptoms because of stigma. And if an provider initiates this STI symptom screening, that will increase the screening. So the challenge with that, though, is that not all STIs are symptomatic. In the case of chlamydia, half of the women that have, half of the men that have chlamydia don't have symptoms. And up to 75% of the women that have chlamydia don't have symptoms. When it comes to gonorrhea, only about 10% of the men that have gonorrhea have symptoms. 10% of the men that have gonorrhea don't have symptoms, and half of the women that have gonorrhea don't have symptoms. So to counteract that, the recommendation is that we use diagnostic tests. On the screen is a picture of the gene expect machine that we use to test STIs. The test that's recommended is the NAT test, which is a new, nucleic acid amplification test, and we use, for men, we use phase void urine to test for the STIs, and for women it's vaginal swab, so either endocervical vaginal swab or vulvovaginal swabs. And for men who have sex with men, rectal swabs. And for syphilis, as we know, is blood tests. But the issue was with the lab-based test is the cost. It's also the fact that you might end up having to have multiple visits for the diagnosis and treatment. The expertise, the lab expertise might not be, you might not have at the local clinic. You might need to come back on another day. So to combat that, point of care tests have been developed, and I'll talk about two of those point of care tests. The first one is the gonorrhea lateral flow assay. This lateral flow assay test has been evaluated by comparing it to the NET test that I just spoke about, to see if it compares as far as performance with the NET test. And it has been shown in South Africa, in the Eastern Cape, to have very high level of sensitivity and specificity. So the next point of care test that I will talk about is the GIVE device. This is the clinical trial that we did at our site. The GIVE device was developed at UCT. It is a genital inflammation test. It basically screens for inflammatory markers, which are cytokine biomarkers. And the aim is to detect STIs and bacterial vaginosis. So the clinical trial that we did is part of a bigger picture, and the other part of it is the integration study, which basically is assessing the acceptability of the GIVE device within healthcare workers. I have a little video, yeah, I don't know if it's gonna play, that talks about the GIVE device. Yeah, no, the video won't play. So I'll move on to the vaginal microbiome, which is also a work that we did at the site. We're currently also doing. The vaginal microbiome research consortium for Africa is aiming at creating a vaginal microbiome biorepository in Africa. And the aim is to identify women with a stable lactobacillus microbiota with no evidence of genital inflammation. The ultimate goal is to select a geographically diverse lactobacillus strains with health-promoting characters that can be co-formulated into LBPs. So basically, probiotics that will help to treat women with bacterial vaginosis globally. So the aim is basically to restore the balance, meaning that we want to put the missing puzzle into the global microbiome biorepository by putting the missing puzzle, which is the African microbiomes. So basically, in conclusion, the take-home message that I want to take home is that the STIs mostly are asymptomatic, and the development of point-of-care tests are currently needed and implemented. So I want to thank you all, and as you say in my language, thank you. Inkomo.